Lecture outline. Introduction to surgical instruments. 1. Introduction. Overview of surgical instruments. Define what surgical instruments are and their role in healthcare. Explain the importance of these instruments in ensuring successful surgical procedures. Why understanding surgical instruments matters. Highlight the relevance for non-specialists such as general healthcare workers, patients, or anyone interested in the field. 2. Categories of surgical instruments. Cutting and dissecting instruments. Examples: scalpel. Describe as a small, sharp knife used for making incisions. Scissors, used for cutting tissues or sutures, often with different types for specific purposes, e.g. Mayo scissors for tougher tissues. Grasping and holding instruments. Examples: forceps, used to hold or grasp tissues, materials, or other instruments during surgery. Needle holder, specifically designed to hold needles for suturing. Clamping and occluding instruments. Examples: hemostats, used to clamp blood vessels to control bleeding. Clamps, used to occlude vessels or tissue. Retracting and exposing instruments. Retractors, used to hold back tissues or organs to provide better access to the surgical area. Speculums, used to expose or hold open an area of the body, like the vaginal speculum. Suturing and stapling instruments. Examples: needles and sutures, explain their use in closing wounds or surgical incisions. Staplers, used for faster close wounds. Suctioning and aspirating instruments. Suction tubes, used to remove blood, pus, or other fluids from the surgical area. Catheters, used to drain fluids from body cavities. Dilating and probing instruments. Examples: dilators, used to expand an opening or passage in the body. Probes, used to explore wounds or body cavities. 3. Materials used in surgical instruments. Common materials. Stainless steel, explain why it's commonly used. Durability, resistance to rust, etc. Titanium, lighter and more durable, often used in specialized instruments. Why material matters. Importance of choosing the right material for different surgical contexts. 4. Sterilization and maintenance of surgical instruments. Sterilization process. Explain basic sterilization methods, e.g. autoclaving. Maintenance. Importance of proper cleaning and maintenance to ensure the longevity and safety of instruments. 5. Innovations and technology in surgical instruments. Advanced tools. Discuss modern advancements like robotic surgical tools. Impact of technology, how these innovations are improving surgical outcomes and patient care. 6. Conclusion. Summary. Recap the importance of surgical instruments in healthcare. Reiterate the significance of understanding these tools, even for non-specialists. Encourage questions to clarify any concepts or terms. References and further reading. Provide a list of accessible resources for those interested in learning more about surgical instruments. This outline provides a clear and structured approach to introducing surgical instruments to a non-specialist audience. Each section can be expanded with examples, visuals, and practical explanations to make the topic more relatable and understandable.